Good day. Hi, my name is Russell Hendrickson. I'm with Practical Data Solutions. Thank you for joining us for today's webinar, Rethinking Physician Compensation in a Data-Driven Practice. Really appreciate you joining us today. And we are presenting live, just so you know that. And joining me is Scott Everett, our Vice President of Healthcare Solutions.
Hi, welcome everybody. Thank you for joining us today. For those of you who are not familiar with PDS, PDS is an analytics company that specializes in healthcare. And for the past 21 years or so, we've helped organizations become data-driven, or for those who were data-driven, helped them become more data-driven through our best-in-practice data modeling and visualizations and dashboards.
And so, today the technology makes it such that you can build, simple compensation reports, with just a bunch of numbers on the page, or you can do, more complex visualizations and publish them out to a PDF, or even using the latest visual technology, you can build slice and dice analytics that are very both graphical and explanatory. And, as we put this together, that's what we really wanted to talk about is, what makes an organization successful and what makes successful physician compensation reporting.
And how would you rate your compensation reporting, particularly when it comes to being timely and effective within your organization? Okay, good. Looks like most of you think it's pretty good. Some of you think it's great. A little bit more than half are pretty satisfied with where it's at, and then others think there could use some improvements, and that doesn't surprise me that much at all. This is a difficult thing that we do. So we want to talk about compensation within a data-driven organization, and before we start talking about comp, we want to really dig into what's it really mean to be a data-driven organization. I mean, obviously everybody says, oh yeah, we're data-driven, and a lot more and more people are becoming data-driven. But if we really want to be a data-driven organization, it means that we're putting our focus always on the numbers, on the data. What is the data telling us? Whenever there's a decision to be made, whenever there's a goal to be set, whenever there's a strategic plan being built, we're looking at the actual numbers. We're not just going off of feeling or what we want to do. We're taking what the numbers are telling us, we're applying that data, and we're finding gaps. We're finding opportunities for improvement, and then we're utilizing the data continually to generate insights from that in order to improve performance as we move forward. So really being data-driven is a lot more than just having data. It's being able to use that data to drive the organization.
Yeah, Scott, you said it best. I always think about data-driven as kind of like fresh air, right? Who's not in favor of more fresh air, right? So it's easy to talk about that. The famous football coach Lou Holtz, he once said, "Nothing on this earth is standing still. It's either growing or it's dying, no matter if it's a tree or a human being." And I've been working in analytics for most of my career, I'll put it that way. And the key is, when I talk about culture, is your culture, is your organization static when it comes to reporting or analytics? You have little investment in tools, and even more so than the tools is even investment in people and training and support. Are you feeding it just like something that's live and helping it grow? And so really, to take data driven a little further, it really is part of the culture. And that sometimes is difficult, but it comes down to having analytics at your fingertips. In the sort of example little chart here we have, not just having answers about, data and analytics at your fingertips, but really understanding what are the key drivers to your business, and then how is your organization performing, and being able to understand both high and low level thresholds. Are we performing above where we expect to be? Or, in the case of denials, are our denial rate out of control over where we're normally able to manage? So being able to alert and understand where changes are occurring. And, conversely, are we suddenly performing below for some reason? Is our production down? Is our patient volume down? Is there something going on, whether it's pandemic related, or maybe we have shortages of staff that we need to understand right away what's going on so we can work to correct it and manage through that information. And then that flows right into, the data we're using in meetings and the discussions that we're having.
Right, and I think one of the big things when you talk about being data-driven is really striving for continual improvement, never really being satisfied with where you are, because there's always some place, some metric where you're underperforming or not quite where you want to be. There's always some, certain individuals that can be better managed to improve their performance. I mean, really by definition, half of your providers are below average from a productivity standpoint, even if they're in the 90th percentile nationally within your organization. Half of them are below the other half in terms of where they are. So there's always ways that you can find improvements, and utilizing the data and the numbers really helps you to find those outliers and manage up to those. And so really, again, when we start talking about compensation and being data driven, where do we get? Now, a lot of organizations, and I've been part of some, they don't do anything. They don't do any reporting or give the physicians any metrics whatsoever with regards to their compensation. And so we've come in and we've seen some places that they'll go in and they'll run the reports and do the calculations, and they'll give them a PDF or an Excel file or a picture like you see there. Basically, they can see where they're at, and frankly, a picture is better than nothing by a factor of infinity. So that's a good place to start. But if we really want to be truly data driven, you need to go a little further.
Yeah, and it really comes back to, and I would say this goes beyond compensation. It really goes back to being able to give, whether it's a physician, it's the frontline practice administrator, the person who's doing scheduling, giving them access to data in a way that they can explore it, whether they can understand their performance in relation to their peers, understand what's going on and trending month to month, and being able to interact with data in a way where they can sort of slice and dice. Or it's even being able to drill down to the details and understanding what is that root cause analysis and what's going on there.
Yeah, so how data-driven is your organization? All right, so no one's really highly data-driven, but there's some that are very strong, and a lot of it depends, and that's great to know. I would imagine most organizations are still within the it depends type of thing, and that's because really, when you think about it, there are some constraints that can factor into how data-driven an organization really is. And so if we look at it and say, well, why aren't organizations really at that highly data-driven level? And a lot of times you think about it, okay, technology is there and it may exist within your organization, but the technology throughout the industry is very prevalent now. Expertise is usually something that's available there. You may even have budget available for it, but a lot of times what happens is that the one thing is all of these are kind of coming in, a bottleneck is created, and most of the time what we're seeing is the bottleneck is created through either organizational culture or leadership, and it's more of a concern. Transparency can be scary. It's a concern of, we don't necessarily know what we should be doing, or it's not part of our overall strategy, or worst of all, what happens when our strategies aren't necessarily aligned. It really keeps data in the background behind where the culture sits.
Yeah, Scott, I was reading, one study, not healthcare, but it talked about companies and the, organizations that didn't feel they were very data driven. And the number one limitation they were citing was really leadership's focus to try to make a data driven organization, and then I think about, certainly big, Fortune 500 companies that kind of have unlimited budgets. All they do is talk about their data and their analytics and driving more. But in healthcare, obviously, we have limits to our budgets. We have limits to how we can grow revenue. And so that, creates some challenges, yet I've still seen organizations that have limited budgets and limited resources still being very data driven, in part because of leadership, right? So let's now tie that though, and this is where I think today's topic really comes together is, so we've talked about being data driven, we've talked about technology. How is it that compensation is often at odds with being a data driven organization? And, to be more specific, why are these two somewhat dichotomous in a sense? Because compensation reporting, as we'll talk about, creates its own challenges. And even if you're, very data driven, you may find that this is an area that your organization is a little weak. So
how often are you doing your compensation reports? Okay,
right.
so we've got a lot who are doing monthly, which is great, and that's really where you want to be, if not, more frequently. And that's, if you're doing like regular reports that are compiled and sent out and things like that. Quarterly and yearly are still better than nothing. Unsure, get that as well. So that's it's good to see this information, and good to see where different organizations sit, because frankly, compensation is something, and especially the reporting, it's tricky, and so it can be a really difficult thing to get into.
Yeah, what's interesting is I would say a few years ago, I don't think we would have seen 2/3 saying they do physician reports monthly, right? But on the other hand, we had about 1/3 of the people attending today are saying they only do them quarterly, right? And so why is it that organizations aren't doing them more frequently? What is the challenge, right? And so modeling compensation data, we are a data analytics company here. We certainly familiar with what it takes to model and blend data. And I would say compensation data can be, depending upon the organization and the number of plans, can be one of the most difficult data sets to work with, because not only do we have different systems, we have different data structures, we have different sort of even alignments. Oftentimes even the payroll data may not line up with the EHR data. So you have this sort of mess of data modeling challenges. But Scott, let's dig a little deeper. Why is it so difficult to make sense of this and make sense of this quickly and in a timely fashion?
Well, I think the problem comes down a lot to consistency. There are a lot of organizations that are on very inconsistent plans, where different providers are on different contracts. We've worked with organizations that even can't get the RVU calculations consistent, where we have to be modeling certain providers on certain different years of RVUs, and sometimes we need to utilize different sources for RVUs, and some use unlisted codes where we have to look at 3 different lists in order to get a calculation for those RVUs. It can get very complex, and like you talked about, with different systems and different data marts that you're working at, where the providers don't necessarily have the same dictionary entry, that it makes it difficult to combine. I actually worked for a large organization once. We literally had a whole physician compensation division that was 5 FTEs in order to do all of the compensation reports and calculations every single month. And of course, even if you do have consistency, you're going to have one-offs here and there. And then what happens when you're in an academic environment, where you have to look at things like research time or academic time, administrative time, call schedules? All of these things can really bring in, lots of complexity in compensation reporting. And so really getting it, and of course, culture, where transparency is a frightening thing. They don't necessarily want to do that because they're really worried about compensation data being out there somewhere where other people can see it. So lots of things make compensation difficult to work with.
Yeah, one of our customers we worked with has their compensation is tied to RVUs, but the RVU values that they're using were tied to the year the physician was hired, which probably in the beginning that made sense, right? When they started doing that, but 10, 14, 15 years later, what a challenge, right? To have multiple sets of RVU calculations just for comp. And that's not unusual. Many of our customers have comp RVUs separated. So it, certainly creates some data challenges. So how do we reconcile all this? What's sort of the ideal of, trying to be a data-driven organization and then supporting physicians with the right metrics and timely reporting that help them not just to understand their comp, but really understand how their compensation relates to the goals of the organization. And so on this next slide, we have this physician who's sort of walking through into utopia or Zion, or this kind of perfect world. Okay, maybe it's not quite that easy, but it was certainly a fun slide that the team put together here. But being able to take all of that data, those different data sets, being able to model it out appropriately, and then being able to do it in as much of an automated fashion. And I don't know many organizations that can fully automate comp, but to do it 80, 90, 100% where they can get their comp modeled out, and then the analytics are available the right way at the right time, is really key. And that's what I would say, big part of data-driven and compensation.
Right. So obviously the technology's there and the data modeling can be done. It can be difficult, it can be complex, but it's certainly there. So really, what are the end goals of what we want physician compensation analytics to be? And if we're being ideal, if we're looking for that utopia that's there, the physicians are going to have really access to it on an almost daily basis if they need it, to find out where they are. Now, they're not necessarily going to get a piece of paper that's showing them. They're going to have something where a tool that they can get in and they can take a look. Obviously, we want transparency, and not necessarily transparency where everybody can see everything, but a level of transparency where I, as a physician, could come in and see exactly where I stand. I can see the calculations that go into my compensation. I can see projections moving forward, and I can better understand, what's the direction I'm going in? Am I where I want to be, and what do I need to improve if I'm not quite hitting my targets? And so I think what you're seeing on the screen right here is really kind of the ideal. It's a very highly graphical dashboard. It looks nice, but it also gives the providers key trend indicators right away, where they can see red, yellow, green. Here's where I'm doing well, here's where I'm not doing well, and here's areas that probably still need immediate attention. Something like this, where you can have security set up and a provider can only see their compensation. The medical director may be able to see all of those under that particular provider, but things like this are really, I think, what you strive for. So how do you get there?
Yeah, and just to go a little further, you can build sort of visually appealing dashboards, but still give the organization, give the physician, give the management, the leadership, the ability to drill right into the data, right? So we're not just talking about building something that's visually appealing, but also making it easy and clear to self-manage beyond just comp. How does this tie into the organization, right? Whether we're including patient satisfaction goals. Here's another example of a dashboard that's been modeled out in the analytics, trying to make it appealing. This one has a little more text to it, a little more content to it, where we can walk through the RVUs, their bonus level plan, how much they've been paid, right? How much is due. And then in this plan here, we've got some key incentive goals. You can see this physician is missing their patient access satisfaction score, which is costing them about 50% of that incentive bonus, right? So you can very clearly see where they're passing or they're failing. And again, making a dashboard in such a way that they could then drill right into the patient SAT data and understand what periods or what time frames potentially might make it easier for physicians to manage through that. So just a couple examples of data-driven organization and physician compensation. So
kind of want to get an idea of, how graphical, interactive are your physician compensation reports? All right, so looks like some people are taking the fifth on it. Some really need work. We have a few that are, they're at the utopia. They're doing a good job with it, and moving towards that. Some just not necessarily interactive, but definitely graphical, nice looking reports that are received by the physicians. And that's where I would expect a lot to be, that, we can give the physicians the information, but can we give the physicians the ability to work with the information is, I guess, kind of the question. And so, ideally, for those who aren't really doing anything or aren't, at the level where they'd like to be, a good place to start is, again, just giving them something. You can make it a little more graphical, make it more charts and trends rather than encyclopedias and numbers, and just email those out. And so you can see, kind of a dashboard that you have right here. Really, it shows what you want it to be. You're being transparent with the calculations, and you're showing the provider, here's how we calculate the comp. They're based upon these different metrics that are out there. Here's the weighting that's given to each one of those, and based upon your performance so far, you fall within this tier, which equates to a salary of X. Okay, it gives them information of where they are, where you expect them to be if they maintain the current trend, and what they need to do if they want to improve that tier and move a little bit forward. It's a good place to start, but again, it's not necessarily where we want to end up.
Yeah, Scott, this example here on the screen, the last two we showed obviously were visual analytics through the PDS Empower tool that we have here, but this dashboard that you're looking at was actually created through Excel. And then it was automated in such a way that it can be published out fairly quickly. And that's why we were showing the example of being able to email out reports and even being able to have them email out with just a click of a button. So, a great place to start making your dashboards more engaging, and then being able to include other content calculations, projections, the status, helping them understand how that comp is compiled. Really make it important. And then, of course, being able to get information out timely.
And, obviously, if you can give them the ability to get more data, that's great.
So a couple other key things, to talk about is that within the organization, even if you're not comping physicians, let's say on patient satisfaction goals, sharing that information and making it easily accessible, making it part of your compensation does definitely drive behavior changes, right? So even if it isn't part of how they're paid, allowing the physician to very quickly see and have access to how is patient satisfaction, what is the organizational bar or goal, are your patients, would they recommend you as a physician? Very important. This is an example of Microsoft Power BI, where we're actually showing a visual dashboard here in Power BI that the physician would have the supporting factors. And then, also, we've been talking a lot about physician compensation reporting, but making sure that management has the ability to go in and understand how are the physicians performing, are they hitting their goals, and, who are our top performers, let's say, from an RVU perspective, and who potentially is a top performer from RVUs, but potentially is lower on the compensation. And maybe as we start to talk about changes in compensation reporting, do we have a plan that is potentially fair, where maybe we have some top performers, but they're not being rewarded, or maybe they're on different plans than some of the other physicians, and that might be an alignment issue that we want to make sure that we're appropriate to that. So just, a couple examples here. Scott, let's talk a little bit about changing compensation, because a lot of organizations, some of the challenges is they have these legacy plans, and yet, they know they need to change them, and things are out of alignment. So talk a little bit about what's driving the need for new compensation plans.
Yeah, talking about compensation and organizational alignment is getting really tricky these days, as reimbursement structures from your payers are changing a little bit. Where it used to be reimbursement was based on volume, and now reimbursement is going to be based more on value. And so obviously you want to keep volume up. It's still important to maximize the time that your providers are spending in patient care, but the volume is going to be a little bit different, where providers a lot of times could, just see a few patients a lot of times. What they want to do is they want to spread out their productivity over a much wider base of patients that are out there if they want to maximize the reimbursement they're going to be getting. There are quality incentives that the organization's going to be receiving, that if you want the provider's behavior to be in alignment, you should check those, particularly with regard to patient experience and patient access. But then, if you really want to make sure that you're optimizing everything, you're going to be really good at wellness visits and risk scoring, and making sure that you're getting complete risk scoring and HCC scoring, and all of your diagnoses are captured to make sure that you're managing your patient care to the optimal levels.
Yeah, we talked quite a bit about that on our last webinar. We were actually talking about denials, but the importance of HCCs, and then how it might tie into compensation. And we'll talk more about how you can see some of our other webinars. That's certainly a key topic you touched on there, Scott. When we talk about changing compensation plans, and for all the different reasons, Scott mentioned, and some of the key metrics that we need to think about, it's very important that you can construct multiple models, different examples that can be reviewed by your leadership or governance committee so they can understand the outcomes. It's very important that you can calculate and compare the salary for the groups of positions typically done by specialty to understand if we change comp, who are the winners, who are the losers, where are we going to see significant changes that may be out of balance or inappropriate to our organization or to the goals of the plan. And really we want to then try to project what is the behavioral change that we might see if we adopt a new comp plan. And so, one of the things that we've recommended certainly is if you're even a proposed plan, you're maybe 80%, 90% through, you've modeled it out, excuse me, and then you want to think about, how might we share with the physician a comp plan? You may want to redesign your dashboards where the first part of your dashboard is now, what are you getting paid on? What's our current comp plan? How does that net out in terms of your salary? But then as you're moving to a new plan, right? Having a single dashboard that actually allows the physician to see, here's what you're going to be paid on. We've added these visit volume goals, this patient satisfaction goal. So there's a portion of your compensation that is now tied to, hitting various goals that are more quality type goals. And so under the current plan, you're not hitting 25% of your incentive. So you can see next year or when this new plan kicks in, your salary will go down unless you start to incorporate that. Giving physicians an opportunity to have the right metrics and understand where they're headed makes a much smoother transition and much easier adoption. It also allows, if there are inconsistencies in your plan, that those questions can be raised ahead of time rather than after you try to roll out a new plan.
Right, and so, a lot of people are thinking, well, with the changes coming forward, when should we make the change? When should we do these things? When should we start to look to improve? And the fact of the matter is, there's never going to be just the right time to do it. You need to start with where you are, work with what you've got, and then just try to find incremental improvements as you go. Better tools will be found as you go along, as I like to quote from George Herbert there.
So Scott, we had used this quote in a presentation. I don't know who did it here in the company several years ago. And I thought, well, George Herbert must be some kind of technology whiz, Elon Musk or Jeff Bezos, right? And so can you explain who is George Herbert?
George Herbert is a 16th century English poet, which is my go-to for all technology quotes these days. So.
Yeah, so kind of ironic, right? That here we're talking about trying to work with what you have and move forward. Didn't even have the internet, didn't even have visual analytics or any of those things. So found that a little humorous, but.
Okay, so let's talk a little bit about some of the key takeaways that we want to, that you hopefully walk away from this presentation with is, make sure that you're looking at physician compensation as part of your organizational strategy and really start looking at it to understand where places where it's out of alignment and work to correct those where you can. Obviously, accessibility to the data and transparency of the data, those are essential parts of a true data-driven culture. Okay, you're not necessarily looking for locking down your data so that people can't see it because you're worried about perception. You need to have that data available. And as we say at PDS, even when the data doesn't look good, we're working to generate light, not heat. We're giving insights for places where we can improve, not places where we can enact punitive measures. And then obviously, if you want the physicians to self-manage, they need KPIs available to them, and they need them in a fairly timely fashion. Obviously, the more timely, the better, so that they can self-correct before things get out of hand. But we really, if you want them to buy in, not just to the performance that's related to their compensation, but also to organizational expectations, give them the data that they need and give it to them often.
Yeah, and I had a customer used to say 2.2 seconds. That's how long people are willing to wait to get to the information they want, about as long as it takes to click the mouse, right? And today that's pretty quick, especially with the cloud, has actually slowed things down a little bit, but timely information. The second thing is, even if your comp plans aren't in sync with, say, your organizational goals of be it quality or patient experience, sharing that information, incorporating that information, consolidating that information is critical, because ultimately the well-being of the organization is tied to hitting those goals. And the physician, certainly, I think most physicians would respond to that if you make it easier for them to understand what's going on and how it ties into their comp, even if it isn't in their comp today. And building better dashboards, investing in technology, small steps can really make big changes. And then, of course, as we just talked about, the continued changes in payments and managed care, value-based care, certainly driving the need to look at your comp plans, but along the way, look at the data and how your organization is sharing that information, and really make it part of your culture that people are thinking about data to drive the organization forward. I guess that's all we had to share today. So thank you so much for joining us. We really appreciate you attending today, and I hope you have a wonderful day and think differently about your compensation reports.
Thanks, everybody.
Have a great day. Thank you.